Thank you. Thank you so much. Thank you so much, ladies and gentlemen. Karibuni sana this evening. I am honored to be your host and your pilot for the day as we go through this session regarding the state of social security in Kenya. As our trainer and facilitator, Mr. Richard, was trying to get himself ready with his gadgets, I was tempted to start asking each and every one of us who already logged in about what we think or what is our interpretation of social security. But because he has already now logged in and I would want us to give him as much time as possible, I will just allow him to take us on and to give us what he has. And should he feel like that it's appropriate for him to ask that question from us, we will gladly contribute. I'll also request that we feel free to utilize the provisions of our platform. We can do a lot of messages so that we can be able to interact as much as possible as we give him ample time that he should be able to drive us through this session. I know there are those who are going to join along the way, but for now, in respect of time, allow me to just say a word of prayer and then we'll take off. Our Father in heaven, we thank you this evening. Thank you for yet another opportunity that you've given unto us that we may gain knowledge. And we want to thank you for the facilitator that you've ordained for this evening, that as we sit and learn from him, we pray that you will give him the grace and the ability to disseminate the knowledge that you desire that we will receive tonight. And I pray for each and every one of us who is sitting in to listen and to learn, that Father God, you're going to help us to be able to receive all the knowledge that you desire for us to achieve tonight, and that we will put it in practice even going forward to the glory and honor of your name. For it's in Jesus' name we pray, amen, amen. Mr. Richard, you're so welcome. I request that you just take us on. You can introduce yourself the best way you know how, and then you can take us through the session as we had discussed earlier. Thank you so much.
Thank you. Thank you. Thank you, Irene. Thank you, all participants that are online. My name is Richard Nyakundi, and I am a social protection policy and research analyst. And tonight, we are discussing the state of social security in Kenya. Before I make my presentation, allow me to thank Allmark Institute for organizing this webinar. And allow me to thank all the participants that are online this evening that have found time to participate at this webinar. And all that we're going to do is that we are going to share with you of what we understand as the state of social security in Kenya. Now, like Irene was saying, the first thing that we need to look at is really to try and understand what do we really mean by social protection. And generally, when we talk about social protection, we are looking at the public and private policies, legislations, programs, and activities that are aimed at preventing, reducing, eliminating economic and social vulnerabilities to poverty and deprivation. You'll note here the critical thing really is about those public and private policies, legislations, programs, and activities. So when you're talking about social protection, it's more than one thing. And the main objective basically is to prevent, to reduce, and where possible, eliminate those social vulnerabilities that cause poverty and deprivation. So basically, as we discussed this evening's session, and as we participate, that definition will come up here and again. But we are in Kenya. How do we in Kenya define social security or social protection? When you look at the social protection policy of 2011, social protection are policies and actions, including legislative measures that enhance the capacity of and opportunities for the poor and vulnerable to improve and sustain their lives, livelihoods, and welfare that enable income earners and their dependents to maintain a reasonable level of income through decent work and ensure access to affordable health care, social security, and social assistance. Now, if you look at that definition, because this is the definition that has been there since 2011, you'll note that it addresses the poorest of the poor in this country. It also addresses the workers, and you'll see like where we are saying that to enable income earners, meaning all the workers in this country, they are also participants and beneficiaries of social protection. But again, looking at the changes that have taken place in this country, there is a revised policy that of 2022. And if you look at that definition, it's slightly smaller, but it has shorter, but it has the same meaning, that set of policies, programs, interventions, and legislative measures aimed at cushioning all Kenyans against poverty, vulnerability, exclusion, risks, contingencies, and shocks throughout their life cycle, and promoting the realization of economic and social rights. Now, when you try to unpack that, you realize that Kenya's social protection is very broad. And this is what we're going to see as we move on. But before we look at that, and because most of the people that are online this evening, they are workers of one form or another. Let's look at the employment structure here in Kenya. And when you look at it, formal and informal, and if you look at the last, for instance, from 2015 to 2021, you'll note one thing very, very clear, that the formal has been decreasing at a decreasing rate, and when you look at the informal, it has been increasing at an increasing rate. For instance, in 2015, the informal was 14,758,000. Look at 2021, it was 18,332,000. When you look at it in 2022, it's around 19.1 million. So you can see that the formal has been increasing as a lower rate compared to the informal. And you realize later as we move on, it has challenges to the provision of social protection. Now, let's look at the labor force participation from 2009 to 2019. Again, you would see that the participation has been increasing. In 2009, it was 69.9. In 2019, the labor force participation was 74.5%. And again, when you look at it in 2022, you note it is about 77%. So it has been increasing. Now, there is something that we need to look at and really ask ourselves in terms as we are moving on with the time. When you look at the current states, we have just said that the formal is not increasing as much as the informal. And yet, when you look later, most of the schemes we have in this country, they cover the formal. And the growth is being experienced in the informal. It has implications. The current state, for instance, we have to ask ourselves, what is the aim of social security in Kenya? How many people in Kenya can afford to save for old age and other risks? Again, during this session, we shall be asking ourselves, what level of social security should Kenyans enjoy? What is their ability to manage immediate risks, for instance, death, disability, unemployment? And again, as we discussed this, you realize during COVID-19, we noted that Kenyans were not able. And we have to ask ourselves, how meaningful is the current social security savings? Those are issues that we shall look at during the session. And of course, our interest is how much money is enough money and adequate when one is retiring. Most of us are having salaries, and I'm sure you have been reading papers. You have looked at even the debate between SRC and the public service. You have looked at the debate of allowances. And you may realize that many of us could be enjoying allowances. And yet our pension is anchored on basic pay. It therefore means that when we retire, our replacement ratio shall be very low. And we have to ask ourselves, for instance, what form of retirement is appropriate? And how many people will reach retirement anyway? And we have to ask ourselves, when you look at the policies we have at the moment, when one loses a job, he accesses 100% of his contributions and 50% of the employer. We have to think in terms of preservation, because for low-income earners, the risk and current welfare is more important. You see, most people are saying today is more important than tomorrow. If I can't live today, then why should you tell me about tomorrow? But again, for high-income earners, retirement is more important, and we need to look at how best can we balance the two. Now, having said that, what is the need for social security in Kenya? And you realize that, one, social security benefits and transfers are a powerful tool to combat poverty and income security. You'll see it. We have programs like Inua Jamii, programs like orphans and vulnerable children, programs like persons with severe disability. When you look at the total of those programs, about 1.3 million Kenyans are covered. And again, when you look at Kenya's poverty rate, you realize that 36.1% of Kenyans live below poverty line, and 8.6% live in adequate poverty. And therefore, social security benefits and transfers are a powerful tool to combat poverty and incomes insecurity. But again, over and above that, it is important that we realize nobody is an island. Every worker, every person, and every family needs protection from social risks and resulting insecurities. We noted this during COVID-19, that even those that we thought were very, very secure, indeed they were not. And again, some groups of people in Kenya are more vulnerable than others, especially those who are economically poor, the agricultural workers, children, and even the elderly. And that is why the Inua Jamii program under the State Department of Social Protection is very, very critical. But again, it's clear that guaranteeing income security and access to health would allow all Kenyans to deal with most significant risks. And that's why you realize we have got the NHIF, and the government is promoting the universal health care, which is also very, very critical and part of our social security system. Again, the social security systems are an economic necessity, particularly if we are looking at how to unblock the full economic potential of our country. And that's why you realize currently there is the conversation around the ASLA fund, the financial inclusion, because at the end of the day, if we don't have everyone participating, then it will be very, very hard to unblock our economic potential as a country. Again, social security, therefore, we can say, is an economic stabilizer in times of crisis. You do recall during the COVID-19, the government pumped in 10 billion so that those who are not able, the most vulnerable in society, could be supported. You do recall during the same time, the government introduced Kazi Mitaani, And you see the same is going on as we're talking about even the tree planting, because at the end of the day, we want each and every person to participate. And of course, Kenyans who do not enjoy a set of social guarantee that allow them to deal with the lifestyle risks, it's important that they are protected as per Article 43, Article 43 of our Constitution. Having said that, just a moment. Having said that, the question is this: what is already known in our country? These are a few things that we know about our country. 25, whenever people retiring normally live about 25 years. We live 25 years after retirement. So assuming you retire at 80, a majority of people live for 25 years, meaning they live up to 85. Now, the other thing that is known is that 10% of income goes to missing every month. And you can look at your income. I don't know, if you take a pen and you account for your salary, you will discover that you can't account for about 10%. Another thing that you will notice that about 91% of East Africans spend more than they earn on things that they really cannot account for. That is really, again, it will be very funny if you look at how much are you earning and how much are you spending. We are spending more than we are earning. Again, another thing that is known, 6% of retirees depend on pension. Now, look at all retirees. Only 6% depend on pension. What is 94% depending on? Why are they not depending on pension? Again, you realize 6% of retirees are still working. That is a fact. In fact, to be honest, even my own dad is working, and yet he's 80 years. So there is a disconnect. Again, you realize 84% of Kenyan adults lack a pension scheme. 84% of Kenyan adults lack a pension scheme. You're going to see later as we move on that we have got over 1,000 schemes, but we'll ask ourselves, who do they cover? 84% of Kenyan adults lack a pension scheme. As we move on, we'll have to interrogate this. Then again, the question that we have to understand, with 84% lacking a pension scheme, why? Social security in Kenya is a right. Article 22 of the Universal Declaration of Human Rights, 1948, states, everyone as a member of society has the right to social security. Come home, Article 43, sub-Article 1E of Kenya Constitution 2010 states, social security is a right. The question is, if social security is a right, why is 84% of our people, why are these people not covered? When you look at the Kenya Constitution and you look at it in terms of social protection, you realize one thing. The Bill of Rights in the Constitution of Kenya guarantees all Kenyans their social and economic rights and binds the states to provide social security to persons unable. And of course, this is very, very clear when you look at the Constitution and especially Article 43, sub-Article 3. And again, social protection, legislative and policy frameworks in Kenya are grounded in our Constitution. When you look at all these pieces of legislation, they are grounded in our Constitution. Article 43 of our Constitution provides the Bill of Rights and makes social security a right. Article 21 of our Constitution requires the government to respect, protect, promote, and fulfill the rights and the fundamental freedoms in the Bill of Rights, and particularly those provided under Article 43. Then again, like I've said, Article 43, sub-Article 1 guarantees all Kenyans their economic, social, and cultural rights, including the rights to health, education, food, and decent livelihoods, including social security. Now, with that kind of background, then, we need to ask ourselves, what is the architecture like of Kenya's pension scheme? What is the architecture like of Kenya's social security system? Kenya's social security system has got 4 pillars. The pension system. The first pillar is what we call Pillar 0. Now, Pillar 0 is a basic public pension that provides a minimal level of protection. This is where we have Inua Jamii. This is where we have orphans and vulnerable children. This is where we have persons with severe disability. This is where we have programs like Anger and Safety Net that is, when you look at northern Kenya, Samburu, Marsabit, Mandera, Wajir, Garissa areas, this is where we have the Anger and Safety Net programs. Then Pillar 1 is a public mandatory and contributory system linked to earnings, and Pillar 1 is NSSF. Now, Pillar 2 are these employer-sponsored contributory or fully funded schemes. You will therefore realize there is a difference between NSSF and Pillar 2. Pillar 2 are occupational schemes. They are employer-sponsored. Pillar 1 is NSSF. So the two are not on the same level in terms of pillars. Then Pillar 3 is a voluntary individual pension plan. Like you realize in our programs, when you go to Jubilee, when you go to Minet, you can buy yourself an insurance and it takes care of you. Then Pillar 4 are financial and non-financial support outside the formal pension. And you realize this is the table banking. Now, when you look at all these, this is what presented under Kenya's social security pension system. It has Pillar 0 for those who get assistance from the government. It has Pillar 1, what we call currently NSSF. It has Pillar 2, employer-sponsored schemes, and you realize those employers who have got schemes, that's the Pillar 2. Then Pillar 3, the voluntary individual, where you and I as individuals, we can go to an insurance scheme and we make contributions either to Minet, ICA, Lion, etc. Now, let's look at a glance. Let's very quickly now look at how is the pension industry in Kenya like. And this has been done, it has been sourced from RBA. You know, RBA is our regulator. And what does RBA tell us? What are the facts telling us? Currently, the fund value, the pension fund value in Kenya is 1.5 trillion. And therefore, it has grown from 40 billion in the year 2000 to now 1.5 trillion. What else do we know? The number of active schemes is 1076. All pension schemes in Kenya brought together that are registered with RBA, as at 2022, they are 1076. What else do we know? The overall membership that participates, and this is the cumulative, is 7,082,462. Now, what is the membership coverage? According to RBA, of all the workers in the Republic of Kenya, only 25% are participating in a pension scheme for their retirement or old age. What does it mean? 75% are not covered. Why should that concern us as a country? Remember, social security is a right, and only 25% are participating, and the 25% are in the employer-based schemes. The other thing that is known is that, remember, there has been concern about when you retire, most of us is when we now discover diseases that we didn't know. And currently, we have got about 27 schemes that are running post-retirement medical fund, and schemes are being encouraged to introduce that so that they take care of older persons. Now, the next thing, like, and I've said this one, and I want to repeat, membership coverage, sorry that I've repeated it, is 25%. I want us to keep these figures in mind as we approach and have the critical thinking under what is currently trending in this country and the debate around the NSSF and other schemes. Now, let's look at the membership coverage. What does RBA tell us? I already said RBA tells us participation is around 95%. And again, if you look at active members employed, that is around 17.3%. If you look at the active labor force, that is around 16%. If you look at the total members, active plus inactive, that is 25%. Now, if you look at active members in NSSF, less 60 years, 10.5%. Now, these figures are very, very important. When we begin discussing the debate around NSSF, this should inform us and should send us questioning. Should we question? Should we support? Should we not support? What should our position be like? Now, as we continue with that discussion, you realize NSSF, if you look at the active and the inactive members, the total is 6.2 million. Active is 2.3. When you look at the individual schemes, they are having 266,000. Active 249. When you look at the central government, 220. When you look at the teachers, 349. So that is what brings the total to 7 million. So it's very, very important. Remember, our population currently is about 54 million, and only 7 million are participating. And again, when you look at the population, the working age, you realize between 15 years and 64, we are having about 28 million Kenyans. Yet, only 7 million are participating in, so only a quarter of the working age population is participating in social security. Now, when you look at the labor force, you realize this is around 19.1 million. And this should also turn us. These are figures and facts that you will get from the Economic Survey of Kenya 2022. We'll wait and see whether around the next month, when the Economic Survey 2023 is released, whether there are any differences. Now, let's single and focus on these two institutions which are providing social security. Now, look at membership at NHIF as of December 2021. The principal members were 10 million. Active were 5 million. The informal, which we have just seen, is over almost 16 million. Only 1.7 were participating. The formal, only 3.2 were participating. The scenario is not any better when you look at NSSF December 2021. The figures we got, there is a disconnect between the figures of RBA and NSF, but this can be corrected. You realize cumulative year means, according to NSSF, those that have been there since 1966, when the program began, a total of it is 9 million. But when you look at the active, according to NSSF, together with the informal is 2.86. The formal, according to them, is 2.3. And the informal is about 600,000. The question then is this: there are about 16 million Kenyans who are in the informal, and only 600 are participating. When you look at NHIF, again, the situation is the same. Where is the problem? Is it the institutions? Is it the law? Or is it our attitude as Kenyans? Now, again, I did say this earlier, and I want to repeat that social protection in Kenya as a constitutional right, it's very, very clear in Article 43, and I've stated about this. But again, you realize that it doesn't stop in Article 43. Article 53 addresses children, and you realize, for some, maybe some of you have come across it. Currently, the government is piloting the universal child benefit grant benefit. The idea is all children between 0 to 2 years and later to 6 years should be covered. Remember, this is the time, if we really are looking at human capital development, we lose our children between 0 to 6 years. And it's very, very important that they are covered. Article 43, of course, makes reference to persons with disability. Article 55 is about the youth. We are all aware about the youth bulge in this country and the concern. Article 56 is about minorities and marginalized groups. And Article 57 looks at older persons, a class where I'm soon joining. Now, okay, based on that, Kenya's social protection and social security uses a life cycle approach, meaning if we have to develop as a country, we must ensure that we cover our people right from childhood to older persons. Now, when you look at the early childhood, you can see we have got programs like Orphans and Vulnerable Children Program. School age, we have got school meals, and you are aware from where you come from. The youth, we have got even the Kenya Youth Employment and Empowerment Programs. And when you look at the working age, we have got National Social Security Fund, we have got the National Health Insurance, and we have got all these programs. And of course, we have got the civil service, what we currently call the Public Service Evaluation Scheme. And you realize even for persons with severe disability, there are programs. Essentially, Kenya's social security system is comprehensive. It addresses from childhood all the way to old age, and you may say from cradle to grave. Now, based on that, as a country, again, you realize Kenya's social protection system is really dynamic. And you realize the proposal for the 2020 Kenya Social Protection Policy has got 4 pillars. The first pillar being the income security pillar. The second being the social health protection pillar. The third being shock responsive. You saw the other day what the rains have done, the droughts, the floods soon coming. And we have to think about, again, we learned a lot from the COVID-19. And we realize that these programs cannot work without complementarities. So Kenya's social protection system is very, very broad, very, very comprehensive. And like I've said, and this is important, and we're going to see as we are soon moving to the critical issues that are affecting the country right now. I've just said that Kenya's social security social protection system follows a life cycle approach: program for children, program for the youth, programs for the working age, and programs for older persons. And again, like I've said, Kenya's social security system is rights-based. It is anchored in our constitution. I've equally said that Kenya's social protection system follows a universal approach, and that's why you realize currently we are having the older persons cash transfer for all the older persons who are 70 years and above. And again, one program alone cannot solve that, and Kenya is using an integrated approach. But most importantly, and this has been said by our president, Kenya's social protection system is transformative. It must change lives, and that's what you see we are trying to do with the financial inclusion programs. Now, having said that, the question is this. Having said that, the question that we need to ask ourselves is, why social security reforms? Remember the statistics we talked about. 7% is not covered. 84% are not having any social security. As a country, look at the workers. The RBA statistics informed us only 25% are participating. There is need to increase social security access to the workers. Again, the other thing that we have got to look at is the issue of increasing level of benefits and amounts in social security. And you'll see this. NSSF, for instance, the 200 shillings that we are talking about and we have been talking about was introduced in 2001. And I want you to look at it. In 2001, with 200 shillings, one could buy 5 liters of fuel. In 2023, with 200 shillings, one can buy only 1 liter. What does it mean? If we are talking social protection, then we must think about contributing an amount that is equivalent. So rather than talking about 200, we should ask ourselves, what is the value of 200, the 2001 200 in 2023? And you may realize it's about 900. So you know that debate we are talking about, we have to ask ourselves, how do we increase the level of benefits and the amounts? Because really, what is 200? And again, it's about adequacy. You'll see when we go to the calculations, we'll have to ask ourselves, if one was to contribute this 200 faithfully, where would one end? And of course, we have got to increase access of social security to all workers, both the formal and the informal. As a country, we have got to think about it. And it's also important that we increase the overall savings. Currently, savings in Kenya is about 12%. Now, when you compare the region, we are the lowest. Again, we have got to increase participation of the Kenyans in the social security programs. And we need to empower individuals to save. And most importantly, our schemes have got to be efficient and sustainable. And of course, we must promote equitability. Having said that, what are the features of Kenya's economic, what is the feature of the Kenyan economy like? One, and very importantly, poor domestic saving, 13%. Two, long history of government saving, and of course, low inflation environment, but the most, very seriously, high unemployment, low finance returns levels, skewed income distribution, high dependence ratios, high poverty levels, rising marginal propensities to consume, and of course, greater social transfers. You can see now, currently the government is spending about 35 billion on social transfers. And we need to ask ourselves, for how long are we going to do this? The question that we have to ask ourselves, what does it mean? It means we cannot plan for our old age. If we don't do anything, then it means we are all candidates for all a person's cash transfer. And that will come, and you see, unless we do something, the government may not be able to sustain that. Now, that is where we are coming from. As Kenyans, we have to think, what kind of future do we have? What do we want for our future? Remember, if you look at what is on the slide, unless we seriously think, unless as Kenyans we reflect on this, you can see we are going to fall. We may not jump to the other side. It all depends on how as Kenyans we get committed. It all depends on how as Kenyans we look at these issues that are touching on our social security, how we discuss poverty issues, and how we care about our workers and what we think about them. But for as long as we want some people to contribute and we won't want others to contribute, then as a country, we are in trouble. Having said that, and this is the reason why in 2013, the government in its wisdom introduced the NSSF Act 2013. Now, why NSSF Act? You see, under NSSF Act Cap 258, it was not possible to provide social security. Remember, it started from 40 shillings in 1966. It moved to 80 shillings in 1978. And then it moved to 200 shillings in 2001. Meaning from 2001 to 2023, there hasn't been increase in amounts, and really you cannot talk about the social protection that Article 43 sub-Article 1 envisages. And it did not meet the expectations of Article 21 of our Constitution. Further, when you look at that act, it did not embrace administration costs, it did not embrace governance, and it was subject to abuse. And Kenya, also you realize, like we have said, Kenya's savings rate is quite low. Kenyans are not saving. So there was a need to look at how can we as a country encourage Kenyans to save. And that's where you realize, when you look at the NSSF Act, that's where you realize it's mandatory. And that's where you realize anybody working in Kenya is expected to save for his old age. And that's why you realize nobody has been exempted. Because unless we do that, remember, as a country, 36.1% of our people, according to the Kenya Household Budgetary Survey of 2015-2016, they live below poverty line. 8.6% of Kenyans are in adequate poverty. Now, unless we encourage and promote savings, it means we are going to have more people falling into the poverty. In fact, if we are to be honest, COVID-19 pushed the figure from 36 to around 42. Now, this is very, very serious. Again, under Cap 258, there was poor social security coverage. If we have to increase coverage of social security, then there was need as government to review that act. And again, when we are talking about social security coverage, we are looking at 3-4 things. One, we are talking about how many people are participating. You have seen from the RBA statistics, 75% of Kenyans are not participating. So in terms of population, you realize that very many Kenyans are not covered. But again, like you realize, under the NSSF Cap 258, only 3 benefits were provided: old age, survivor, which is death, and invalidity, which you may call disability. Yet we are going to see in 1 or 2 minutes, there are more what you may call, there are more benefits than just old age and that. There is unemployment, there is maternity, etc. But again, the old NSSF Act, it did not meet the ILO minimum standards, 200 shillings, honestly. Yet, ILO minimum standard is, after you have saved for 40 years, your minimum should be around 40%. So, but the problem was not with the Act. If you look at the Act, it was providing for 5% of gross and 5% from the employer, making 10%. But unfortunately, it had a monetary capping of 40 shillings, 80 shillings, and 200. And so something had to be done. But again, you realize that most of the schemes we have in Kenya, that are employer sponsored. Remember, employer-sponsored schemes is not mandatory. So as a country and as a government, there was need to review NSSF Act, because government cannot stop its role and it cannot transfer its responsibility to the private sector. Again, when you look now, what has happened? When you look at when the NSSF Act came into being in 2013, a lot happened. First, if you look at that journey, the National Social Security Fund Act came into effect December 24th, 2013, and the commencement date was 10th January 2014. What happened after that? A case challenging the act was filed by Kenya Tea Growers Association and 14 other employer and employee associations. Fast forward, in September 2022, the NSSF Act 2013 was declared unconstitutional. Come February 2023, the appeal court overturned that. And as we speak, that act is fully being implemented. But again, as we speak, there is a case in the Supreme Court challenging that ruling. Now, with this kind of drama, you have to ask yourself, when shall we cover these 75? When shall we ensure that Kenyans save enough? When shall we ensure that Kenyans don't retire in poverty? These are the issues we need to ask ourselves. Now, what are the objectives of the NSSF Act 2013? When you look at that act and you look at Section 4 of the act, you realize, one, the act seeks to provide basic social security. Two, it seeks to increase membership coverage of the social security scheme. And three, it seeks to improve adequacy of benefits paid out of the scheme by the fund. But again, it also seeks to provide opt-out, which we'll later talk about and see really how is it going to be done. But again, it seeks to bring out and bring the informal people into it. Remember, CAP 258 focused on the formal, but NSSF number 45, because of our constitution, which makes social security a right, it therefore means that NSSF, as a public mandatory scheme, it must cater for both the formal and the informal. And of course, the NSSF Act number 45 requires that NSSF operates and manages itself in a manner that is value adding. That when you are declaring benefits and interest, that you declare interest that is commensurate with the members' contributions, and which is very, very important. But as we are talking about this, we also need to look at what is the thinking and what are the minimum standards. And you realize that NSSF under CAP 258, it was nowhere under the ILO minimum standards. Look, for instance, what I've put in red. All the age benefits. The minimum income replacement is supposed to be 40%. Under CAP 258, NSSF has been performing 3%. So there was need to change from 200 to 6% employer and 6% employee. Now, if you look at it this way, 6% employer and 6% employee, and you make an assumption that one works from age 18, and every year there is 1% saving, it therefore means that when one reaches 60 years, the person would have saved